Dr. Thomas Romo, and welcome to our office. Having performed cosmetic reconstructive surgery in New York City for 22 years and being the director of 2 hospitals at Lenox Hill and Manhattan Ioneer, my knowledge and fund of knowledge about the conditions that we're taking care of is extensive. I actually have developed many procedures, surgical techniques, instruments to manage these problems, and I publish regularly academically in the medical journals and teach nationally and internationally. We truly care about our patients, their concerns, trying to find out what their needs are, what they actually want. Once we determine some of the concerns of the patients, I like to sit down and actually spend quite a bit of time explaining what the different treatment options are. Then we try and come up with a comprehensive and overall treatment plan. Part of that process that we want to make sure that they understand is the concept of rapid recovery. And rapid recovery is not a technical procedure, it's a philosophy. I mean, people bring to the table all kinds of problems. Irregular heartbeats, little diabetes, overweight, and you need to know, maybe on medications and smoking, and you need to know all of those things before they go to surgery so that you can get them on the right path. Number 2 is the surgical experience. Many of the procedures I designed, and I designed the instruments for. So when we bring that too, we think we bring in endoscopy, which limits the size of the surgery. Smaller surgery is quicker recovery time. And number 3 is attentive postoperative care. After surgery, we have a surgical nursing staff that takes care of those patients. Therefore, if you know the patient before and take care of them during and after surgery, they will have a rapid recovery. Additionally, safety. With every procedure, with every intervention, there's risks, and what we want to do is limit those risks. We don't take anything lightly here. Every procedure, any intervention from a Botox injection to a surgical procedure is managed, evaluated and managed in a comprehensive and caring way. Additionally, this is a practice in New York City. What we do is we see patients locally and nationally and actually internationally. The clientele, we regularly have people coming from Europe, people from all across the United States who are looking for superior care. Today, with the IT and capabilities of the internet, we have patients sending us pictures from all over the world. We evaluate those, we interface with them, we actually get to know them pretty well before they come here, get them cleared by their physicians locally, which is more convenient for them. We have a system where we work with a group of hotels here in New York where they're put into these nice suites, not too pricey, and they're looked at before, and then that's where they end up recovering as well with our surgical nurses that we have. So it makes for a very comfortable and convenient and economical activity for them to take care of. So they can bring their family, or they can bring their loved one, because they can stay there, the kitchenettes are there, and it allows them to have a safe and a comfortable recovery. Additionally, we have people from Hollywood, we have people from Broadway, actors, actresses, who require privacy. And we address those issues all the time. Confidentiality is paramount. We have a separate entrance into the office for those individuals who need to come in and come out of the office. Very important to me, as substantially as important, is treating the patient who's not the celebrity. And they're wondering, is this going to be too expensive, too high-end? It's very critically important to also be able to manage everyone with superior care. And we want to make sure that we take care of them with the same care and concern as we would with a celebrity. And I think that's really paramount. People ask me all the time, how do you know you're going to a good doctor? Why would I go to you? Why wouldn't I go to somebody else? The best referral is always another patient, somebody who's been there, and query them, ask them questions. Who did you go to? What kind of experience did you have? Those are wonderful. Other physicians, ask your family doctor, ask your dentist, ask people in your family. I get referrals from many people, from many ways. You have to realize that as wonderful as the internet is, which is a wonderful source of information, there is no internet police. So anybody can say anything they want to about themselves. I think you need to go to somebody who's board certified. Have they published in the field? Do they lecture in the field? Do they teach courses on these activities? Obviously, in my case, because I'm in New York and as the director of 2 hospitals here, I lecture and publish and teach physicians all over the world how to do these new techniques. And I think that's one of the things is, besides truly caring about our patients, is that we also understand and regularly perform these procedures and have state-of-the-art procedures for our patients so that it offers them safety and offers them reliability. You know, everybody wants to look natural today. And in order to look natural, there has been a tremendous paradigm shift, a change in the understanding for physicians in order to treat these patients. If you pull skin only, then what's going to happen is you're going to distort the anatomy. So everyone's seen the woman with a bad facelift, the corner of her mouth pulled up, looking like the Joker. We as human beings develop something called the aging face, and it is a pattern. And the upper portion of the face ages a decade before the lower portion of the face. And it's not only laxity of skin, but it's also we lose muscle, fat, and bone in our face. And that's where fillers have become so important. Using fillers, using augmentation to restore the youthfulness and then limit the pull on the skin. If you do that, what you will do is produce a more natural look. And that's how you do it, and that's what really everyone wants today.